Good evening. This is Dr. John Bennett broadcasting from Miami. Tonight we have another in the continuing series of Parkinsonism educational hangouts with world-renowned Parkinsonism educator Dr. Abdul Rana, a neurologist from Toronto. Tonight, Dr. Rana is going to talk about prevalence and risk factors for Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett. How are you doing tonight?
Very, very good. It's getting a little chilly in Miami. It's down to 60 degrees. How is it in Toronto?
So we are okay. It's getting better slowly.
No more snow, right?
No more snow. Yes.
Okay. Let me start off, doctor, with a question. What is the prevalence of Parkinsonism?
Unfortunately, the incidence of Parkinson's disease has not declined over time. Parkinson's does affect all races, occurs worldwide, and about 1% of people above the age of 65 are affected with Parkinson's, and about 2% of people above the age of 70 are affected. So more than 1 million Americans and 100,000 Canadians and between 6 to 7 million people around the world are affected with Parkinson's disease. With respect to the incidence and prevalence, different reports quote different numbers. Likely the incidence, which is a number of new cases in a population of 100,000, is reported to be about 20, and the prevalence is 160 in a 100,000 population in a year. The prevalence is much higher than incidence because this is a chronic disease. And unfortunately, there have been reports that the prevalence of Parkinson's disease may become double by 2030. The overall prevalence in Europe is 1.6%, and the prevalence of Parkinson's disease in North America, some experts think, is higher than China and Nigeria. The prevalence in Afro-Americans is closer to Caucasian Americans, and it is not closer to the Nigerians in Africa. So there is some opinion that this may indicate that Parkinson's follows geographical boundaries as well. So probably it is the interaction of both environmental as well as the genetic factors which causes Parkinson's disease. And the prevalence of Parkinson's disease does increase with age, and it's slightly more common in men as compared to women.
Okay. Does the Parkinsonism affect mortality?
Yes, Parkinson's disease, because of its complications, does increase the rate of mortality in patients. One of the North American studies have reported about 2 to 3 times increased risk of mortality in Parkinson's disease patients if you compare them with their age-matched people. And European studies have also reported a higher rate of mortality in patients with Parkinson's disease as compared to normal population. Now, sometimes when patients are admitted to hospital, they have Parkinson's disease, and when they die, so Parkinson's disease may not be noted on the death certificate as a cause of death. Rather, it may be written as cardiac arrest or cardiopulmonary failure or some other cause, which may be a complication of Parkinson's disease. So therefore, the increased risk of mortality in Parkinson's disease may not be truly reflective, because this is not noted in some cases as cause of death. If you adjust the rate of mortality in patients according to age, so it is at least twofold as compared to the normal population in patients with Parkinson's disease. Unfortunately, the incidence of Parkinson's disease as well as prevalence also increases with age, and as I was mentioning, that although Parkinson's disease occurs in all races in all parts of the world, but different reports have reported that the incidence of Parkinson's disease may be higher in the Caucasians in North America and Europe as compared to people in China or Japan, and the lowest incidence may be in Africans. So we are not sure that these numbers are really true numbers, or they simply reflect the better diagnostic facilities in North America and Europe. However, there are reports supporting that the prevalence is higher in certain populations as compared to others. When these patients get admitted to hospital, so their cost of care increases. If you look at the cost of the physician care, the drug cost, as well as their length of hospital stay, so it is also higher than normal population. Various numbers have been quoted, but between 1 to 2% higher as compared to general population. And usually from the diagnosis of Parkinson's disease up to the mortality, so a duration of 10 to 13 years have been reported. Now this shorter life expectancy, although the exact cause is not clear, but most experts think that it is due to complications associated with Parkinson's disease, such as aspiration, falls, skin ulcers, dehydration, malnutrition. So twice as many Parkinson's patients, they die from aspiration pneumonia as compared to general age-matched population.
What are the protective factors in Parkinsonism?
This is a very interesting question. The protective factors, when they are present, so they would decrease the risk of a certain individual from developing the risk of Parkinson's disease. So many different factors have been studied, such as smoking, nicotine, caffeine, some of the NSAIDs, omega-3, as well as hormone replacement therapy. And some of the factors are agreed upon that they are the protective factors, whereas there is some controversy about other factors which have been studied. With respect to smoking, those people who smoke, or even if they use the smokeless tobacco, they have decreased risk of developing Parkinson's disease. So why this happens, we exactly don't know. It could be that nicotine have a neuroprotective effect, or some experts do think that nicotine may decrease the activity of monoamine B oxidase, which is an enzyme responsible for the oxidation of dopamine. So when this enzyme goes low, see, the dopamine levels will be available in more amount in these patients. So that could be one of the cause that these patients would not develop Parkinson's disease. Another thought could be that a chronic low exposure of nicotine in smokers may develop a tolerance in patients against a bigger insult. But overall, because smoking has so many bad effects on human health and cardiovascular disease, premature aging, and cancer, that experts don't recommend smoking to prevent the development of Parkinson's disease, even if a patient, even if a person has a strong family history of Parkinson's disease. Because due to smoking, there are about 3 million deaths around the world, which could be attributed to smoking, and some figures suggest that this could be increased to 8 million by 2020. So smoking is no way advocated as a means to reduce your risk. However, because of the study of nicotine and relationship with the development of Parkinson's disease, this has led us to some new insights into the mechanism of neurodegeneration. Caffeine is believed to be another protective factor against Parkinson's disease. Some of the NSAIDs, they are also thought to be a protective factor. The exact cause, we don't know, but it could be due to anti-inflammatory effects that NSAIDs may help against the glutamate-induced toxicity. Now, if you take the smoking and caffeine and NSAIDs either as independent factor or a cumulative factor, their effect is quite significant against the development of Parkinson's disease. One of the NSAID, the ibuprofen, is reported to reduce the risk of Parkinson's disease significantly. Flavonoids are they are found in the berries. They are a natural source. So if a person consumes them regularly, according to some reports, the risk of Parkinson's disease may be decreased in them. The flavonoids, they do reduce the blood pressure, according to some reports. However, I don't think that effect has any relationship with the development of Parkinson's disease, but some reports have suggested that eating apples or those flavonoids, which are a rich source of anthocyanins, so they could significantly reduce the risk of Parkinson's disease of a person in both men as well as women. And so these type of anthocyanin-rich foods are in the blueberries as well as strawberries. So probably they cause the increase in dopamine release, they might reduce the oxidative stress, and they might decrease neuroinflammation. However, these reports are very preliminary, and a lot of evidence is needed for these things. With respect to the risk factors of developing Parkinson's disease, the age is the main risk factor. Usually with increased age, the risk of Parkinson's disease increases. The mean age, although, is 55, but the risk keeps on increasing as a person ages. And as I was saying, men have a slightly higher risk of developing Parkinson's disease as compared to females.
Okay, doctor, this one question which is pretty important. How is Parkinsonism diagnosed?
Yes, we will talk about diagnosis. I have few more things to say about the risk factors.
Oh, okay. I'm sorry.
The gender is also important with respect to the risk. It has been reported that the men have a higher risk, but if you compare the females after menopause, they might have an equal risk. So some experts think that estrogen may provide a protection of some sort against Parkinson's disease, and those women who have undergone hysterectomy, they have higher rates of Parkinson's disease than the women who have not undergone hysterectomy. Family history is another thing. With respect to a first-degree relative or a sibling or a child parent pair, so risk of Parkinson's disease increases. The relative risk is between 2 to 3 for these risk factors for the first-degree relatives or siblings. Another thing which has been reported to be associated is exposure to pesticides or herbicides, and those people who live in rural areas or drinking well water. So these have been also reported to be risk factors for developing Parkinson's disease. Now, it could be the case that people who live in rural areas, they're exposed to well water, and then they have more exposure to pesticides because of the use in the fields, so that could be the case. So in addition to this, head trauma in boxers, so there is increased risk of developing Parkinson's disease. In addition to head trauma, amphetamine use. Amphetamines are also thought to be, they selectively may damage dopaminergic neurons. The common use of amphetamine occurs in patients with attention deficit hyperactivity disorder or patients with narcolepsy. The use of methamphetamines is also associated with the higher risk of Parkinson's disease, according to some reports. These reports suggest that methamphetamines selectively damage the dopaminergic neurons in brain, and they lead to Parkinson's disease. Some of the industrial solvents, such as trichloroethylene and tetrachloroethylene, they are commonly associated with the Parkinson's disease. They could specifically target the dopaminergic neurons. And some of the reports have suggested a combination of toxins and genes. So if a person gets, if a person gets two copies of a gene ABCB1 and is exposed to pesticides such as DDT, so that combination would put that person at a high risk of developing Parkinson's. So that could be an example of interaction between the genetic and the environmental factors. With respect to the diagnosis, as we were discussing,
yes,
the diagnosis of Parkinson's disease is based on history and physical examination. So the history has to be very detailed, especially the motor symptoms such as bradykinesia or slowness of movements is very important. That is one of the cardinal features. Another is resting tremor, and then rigidity. So if a person has, out of 3, if patient has bradykinesia and 1 of 2, rigidity or a resting tremor, and they respond to levodopa, most experts would take that the diagnosis is correct about Parkinson's disease. So although Parkinson's disease causes many non-motor symptoms, such as dementia, depression, speech problem, sleep problem, hyposmia, drooling, frozen shoulder. So, but still, the diagnosis of Parkinson's disease mainly rests on the motor symptoms. If a person does not have motor symptoms and they do have non-motor symptoms, such as in some patients, the REM behavioral disorders could start many years before the motor symptoms of Parkinson's disease, but still we can't make a diagnosis of Parkinson's disease based on the non-motor symptoms. Patient has to have a few of the cardinal motor symptoms, and then non-motor symptoms they add as a supportive evidence. So with respect to testing, the CAT scan or MRI, they usually don't help. They usually either show age-associated atrophy if patients are elderly, or some small vessel ischemic changes, which could be related to many vascular risk factors or age. So usually investigations are not needed in these patients unless there is some focality or some other concern of the physician. So basically the history plays a very important role in a detailed neurological examination.
And cerebral spinal fluid is not diagnostic of Parkinsonism at all?
Right. At this point, the CSF studies are not considered any diagnostic test of choice for Parkinson's disease.
Okay. Very good. We have a question from Japan, a tweet from Japan on the air to the website Japanese Medical TV. Simon Downs, he asked, Dr. Rana, do you communicate with any Parkinsonism doctors in Japan?
Not that I have any particular collaboration with any physicians from Japan, but we do have some of the studies which are published by Japanese neurologists. They have done excellent work in Japan, so I have gone through some of their work. but not that we have any particular relationship. We'll be happy to do so, though.
Okay, maybe Simon can hook a network with some doctors over there and get them on the panel. I know, Dr. Rana, I ran into a doctor that does research with stem cells in California, with stem cells in Parkinsonism, and maybe I can get them on the panel with you.
Sure, that'd be great.
Oh, and okay, Dr. Rana, anything else to say about the prevalence and risk factors for Parkinsonism?
With respect to Parkinson's disease, the detailed assessment of patients is very important. The patients are usually elderly, and sometimes they might attribute their symptoms to age, or some of the symptoms such as depression or drooling, they might attribute to certain factors. They might see that they are tired, or they have joint pains. This is because of arthritis, or they're depressed because they're living alone, or they're anxious because of these things. So a lot of these things get labeled due to some other reasons, and these patients remain undiagnosed, and as a result, they're untreated. And the symptoms of Parkinson's disease have a very negative impact on a patient's quality of life. And sometimes it happens that these patients would keep on suffering in silence. So a detailed assessment by the treating physician, not only at the time of diagnosis, but also in the subsequent visits, during follow-up visits, each and every non-motor symptom should be reviewed with patients, and educating patients, providing them literature as well as caregiver. It does help to bring those symptoms in attention, which appear with time. Otherwise, if you don't educate patients, then these patients would never discuss things with their physicians. So those complications or non-motor symptoms of Parkinson's disease remain unaddressed. So a detailed and thorough assessment, and sooner these patients are referred to someone who deals with movement disorders or Parkinson's disease, better it is. So I think the importance of addressing all factors which are surrounding a patient, addressing their various aspects of their life which are being affected with Parkinson's disease is so important in this disease, especially because this, I believe, is one of the most complex neurological disease which affects so many systems. So I always tell patients that if you notice anything extraordinary or anything new, just make a note. If you can't see us immediately, make a note. When you come for a follow-up visit, do discuss with us. But patients are still sometimes shy. Such as symptoms like sexual dysfunction, they would never bring in attention unless you prompt them or you lead them. So this is very important for physicians to take a lead for these patients. I'm still a student of movement disorders, Parkinson's disease, and neurology. So I learn every day when I attend to these patients new things. Sometimes they would report a symptom or a phenomena associated with their treatment or drug, that it does increase your interest, and then you need to look up or make some research that how to address that issue. So it's quite important, I think, that these patients should be thoroughly seen, and enough time should be allotted to these patients, and also the healthcare organizations should promote education of Parkinson's disease, not only among patients and caregivers, but also in general public. Unless the people are educated, they are not going to seek medical care for their issues.
You know, Dr. Arnold, that's one of the things we'd like to do with the platform of Google Hangouts, is to engage patient support groups.
Right.
As you said, sometimes they don't want to tell things to their doctors, but they will tell them to other patients, and they may share things with other patients, but we hope to leverage that. Well, Dr. Rana, thank you very much for another in the series of continuing Parkinsonism education. We'll continue tomorrow night at 9:30 Eastern Time, and it can be seen at Parkinsonism TV. Thank you very much, Dr. Rana.
Sure, thank you. See you tomorrow.
Good night.